If I suspected I had cancer, and actually, oh man, it was about a year and a half, 2 years ago, I thought I had ovarian cancer because I went through menopause at 56, and it was a year and a half later and I started spotting. And when you start spotting, usually that's cancer when your period starts coming back. And the pain, I had real bad pains in my ovary. So I actually believed this because I thought I had cancer, and I think I did. So I can say this firsthand. I really mean this. First thing, do not ignore your symptoms. I wasn't going to go to the doctor. I was going to take care of it naturally, but I didn't ignore them. As soon as the pain started coming, as soon as I started spotting, I hurried up and developed a protocol. There's so many people who think that, oh, yeah, I think I might have something going on there, but I don't want to know. And I had people come to me that doctors had diagnosed having cancer. They said, oh, I knew 6 months before the doctor told me that I had cancer. Well, that just makes it go even further, and your body's even weaker, and it's harder to overcome. So don't ignore it. Learn the symptoms of cancer. Learn the symptoms of good health in general. The further you stay in the good health area, the less likely you are to ever develop cancer. Also, do not think it's a death sentence. Yes, there are people that die while having cancer, but did you know, do some research, most people die while having cancer, but they don't always die of the cancer. So the amount of people that you see die, many times it's not from cancer itself that killed them. I would also do this. I would use the best of both worlds. Now, I didn't go to the doctor to get diagnosed to see if I had cancer because I didn't have any insurance. If I had insurance, I wouldn't have to pay the penalty tax like I did last year. But if I had insurance, I would have gone and probably had an ultrasound or something. I would not have had a biopsy, but I would have had an ultrasound to see indeed if I did have cancer. So that as I did the natural health, the doctor, I could have him check again and see if it was working. You know, this bit about, here's a line. You stay on this side of the line with natural health, or you stay on this line of the map with the medical profession, is silly. Talking about not thinking outside the box. You know, there's two separate boxes here, and some people think you can only draw from one box, but it's not true. So get the best of both worlds. And I would not accept any opinion. I would always get a second or third opinion, no matter who it was from, if it was a medical doctor or if it was a natural health professional. I became an ND because there was a woman that I was working with that was doing really well. She had breast cancer that the whole breast was eaten off. There was no more nipple. There was no more breast tissue. There was this big, gaping, oozy sore where her once ample breasts had been. And she couldn't even walk. They had to carry her into the house. We started giving her herbs, and she started doing poultices. She gained she weighed up to 86 pounds because she was less than 86 pounds whenever she came to me, and she was 5'10". But she gained up to 86 pounds, and she was able to walk a city block. And the skin, although the breast tissue didn't come back, it was starting to heal over. Like you would just see flesh. Not flesh, just like skin. So she was doing really well. And she went to this person and said, since you're doing so good, you'll be able to travel down to this naturopathic doctor. So come with me. And they went down to the naturopathic doctor, and he said, oh, well, cancer, you just starve out with grapes. I don't want you eating anything but grapes. She said, well, this naturopath told me the vegetables, and he says, no, just grapes. And he says, don't take your herbs either. That's all you need is grapes, and then take this concoction that he gave her. I don't even know what it was. And she ended up dying shortly afterwards. And what she died of was starvation. She weighed 86 pounds. She was too weak to go on a diet like that. Most people shouldn't go on a diet like that. So there are people out there in the natural health field that know what they're talking about, and then there are people that they're whacked. Seriously, I have heard some things that people are told by natural health professionals that are scary. So always get a second or third opinion and understand why you're doing what you're doing. Okay. Now, there's some tests that I think people should take at a certain age on a regular basis. I think men should all, whenever they hit around 40, should start getting a PSA, baseline test. Why not? They suck a little blood out, they test it, it's outside your body, it doesn't do anything that's going to cause a problem. If you have had multiple partners, or your partner has had multiple partners, then I would get a pap smear. I normally do not like a pap smear because I've heard of people getting yeast infections, and one person got herpes. When I had an internal one time, the doctor answered the phone, and they went to examine me. I said, no, you changed those gloves. I don't know what's on that phone. So even though they have a lot of disposable stuff nowadays, you could end up with a bacteria in there if you don't need to. But if you've had multiple partners, or like I said, your partner had multiple partners, then you might want to make sure you do not have the HPV virus. Breast ultrasound, I have no problem with breast ultrasound. I think a yearly breast ultrasound is probably okay. I do like people doing breast exams better, because most people, they come to me and say, I found out I had breast cancer. Either they or their spouse found it, and then they went and was diagnosed. So I really advocate that. But in between time, a breast ultrasound is okay. I do not like breast mammograms. For one thing, for years and years, people that came to me that had breast cancer, the mammogram didn't pick it up anyhow. Then you damage the breast. I had this one woman come that her whole breast was black and blue, and there's blood coming out of the nipple. That's not good for breast tissue. And then they put radiation through that. If they do a mammogram and they see something that's not very good, they'll say, we need to get her a better look. Let's do an ultrasound, because an ultrasound is more accurate. Well, then why do the mammogram? Just do the ultrasound. Doctor will give you a little bit of headache, but you know what? Ultimately, the doctor's working for you. So I would say, no, I want a breast ultrasound. I also think C-reactive protein and homocysteine tests and blood tests on a regular basis is helpful. Blood tests aren't the most accurate tests because the body tries to keep the blood as pure as possible, but there's still a lot of things that you can see. C-reactive protein and homocysteine will indicate, homocysteine will indicate your diet and your kidneys and your pH levels, stuff like that. C-reactive protein directly tells you how much inflammation is in your body. Well, you want to know that because most cancers stem from inflammation. There's a problem, it causes inflammation, and then usually turns into cancer. So C-reactive protein is a very good idea. Biopsy, however, I would not do. Let's say they see that you have a lump in your breast. I would not do a biopsy. I would say if you think that it is contained, or you can get it all, I want you to just take the cyst or the fibroid or the tumor or wherever it is out, and once it's outside of my body, then you can biopsy it. Because a lot of times what happens is the body will wrap almost like a cocoon-like tissue around cancer to protect you from it. If you even do a needle biopsy and pierce it, that cancer can then escape, metastasize. So if you go to a doctor and they find out that you have cancer, there's only 3 treatments that a doctor has. Remove the cancer. And sometimes that's a smart thing to do. If you have cancer in your uterus, especially if you're over like 40, 45, your body's not going to try to actively work on that because your time to reproduce is off. So I would probably get a hysterectomy. If it's in the breast tissue, then remove the breast. So sometimes that's okay. Sometimes it's not wise to. If it's contained like this, where there's safe margins, then yes. But sometimes cancer goes like this. Oops, those are supposed to be touching. They have tentacles out everywhere. If I saw this in my breast, this kind of tissue, I probably would not get the cancer removed. Instead, I would work with it herbally. Perhaps even get the body to start encapsulating it. Then doctors have chemo. I had a doctor from Pittsburgh that would send patients to me that I know, and the people that work with me know, that if someone lives through chemotherapy, they live in spite of it and not because of it. Most people die after they've been diagnosed with having cancer. Most of them die from the chemo and what that does to the body. Radiation, definitely not my first choice either. So those are the only 3 treatments that doctors have. We in the natural health field have a lot more tricks up our sleeves. And I think in the long run, better tricks up our sleeves.